Can sleep apnea cause low white blood cell count? If you're wondering whether sleep apnea can affect your white blood cell count, you're not alone. Let's break down the connection between sleep apnea and your immune system. Sleep apnea is a condition where you stop breathing for short periods during sleep, leading to poor sleep quality and a range of health issues. One of the key concerns is how it impacts your immune system. When you have sleep apnea, your body doesn't get the quality sleep it needs. This lack of sleep can inhibit the function of T cells, which are crucial for fighting off viral pathogens like the flu or even cancer. Without enough sleep, your T cells become less effective due to higher levels of stress hormones like noradrenaline and adrenaline. Now let's talk about white blood cells. White blood cells, including T cells, natural killer cells, and others, play a vital role in your immune system. Sleep apnea can disrupt the balance of these cells. However, the question is whether it can cause a low white blood cell count. Research indicates that sleep apnea can lead to an increase in certain types of white blood cells rather than a decrease. For example, studies have shown that apnea can cause an acute increase in white blood cells, particularly monocytes, lymphocytes, and neutrophils, due to the body's response to hypoxia and reoxygenation. In fact, one study found that, after an episode of apnea, there is a biphasic response in white blood cells, with an immediate increase followed by another increase a few hours later. This suggests that sleep apnea can actually trigger an increase in white blood cell count as part of the body's immune response. So, to answer your question, sleep apnea is more likely to cause an increase in white blood cell count rather than a decrease. This increase is part of the body's response to the stress and hypoxia caused by the apnea episodes. In summary, while sleep apnea does affect your immune system, it typically leads to an increase in white blood cells as the body tries to compensate for the lack of oxygen and other stressors. If you have concerns about your sleep or immune system, it's always best to consult with a healthcare professional for personalized advice.